Well, we've got a labor and delivery nurse in here, Buffy Benthal from North Little Rock Baptist Health, and she's going to talk about some of the things that you need if you are going to have a baby real soon. And there's some of the items, and we'll hear from Christina coming up a little bit later, too. Hey, welcome back to the program. Glad you're with us on this Tuesday morning. Melinda and Steve holding forth here at the Good Morning Arkansas studios where it continues to drizzle outside.
I hope if you're inside, you just get to stay on the couch on a rainy day and stay with us. We've got a fun 30 minutes left, and we've got Christina Munoz here.
Yes, how about that? We love to see her in the daylight hours, and I don't know how excited she is about getting up as she works her way into her third trimester, but she's over there getting some good sound advice from Buffy Benthal, who is a labor and delivery nurse. She actually took time off from birth and babies to come to the Good Morning Arkansas studios this morning to talk to Christina about what's to come and still some of the challenges and how to stay comfortable when you're getting down to the last few weeks. And Christina, I think, it's down, what, 8 more weeks? She'll tell us coming up. I think she's about 8 weeks to go.
About 8 weeks. It's getting exciting.
Speaking of quarters, well, really more trimesters. Christina Munoz is here. You know, she's expecting a baby, and she needs a little professional advice. So we've got a labor and delivery nurse here to talk to Christina. We're coming right back. Don't go away. Well, if you've been watching Channel 7 for the past 6 months or so, you probably know by now that Christina Munoz is expecting a baby, and we've sort of been following the pregnancy here on Good Morning Arkansas because it turns out a lot of women find themselves in this situation, Christina.
Amazing how many there are out there at the same time. You know, everybody goes through it, so it's been fun to share it with our viewers and kind of experience all of it and hear their experiences as well.
Exactly,
so
and the experience changes as you move through the evolution of the pregnancy, and you're into your third trimester.
Yes.
So Buffy Benthal is here. She is a labor and delivery nurse over at Baptist Health in North Little Rock, and thank you for coming in. I know normally you're on the floor right now.
I am. They're expecting me back to work soon. So, yeah, I'm excited. I'll be there in a minute.
Yeah, we'll let you go in a second.
Well, Christina, as we mentioned, you're getting about 2 months away now, and
a little over,
you begin to experience some of the discomforts as you get closer. And what's bothering you right now?
And I knew all of these, you know, would be coming. I guess the main ones for me have been really bad leg cramps and foot cramps, and then lower back pain. So those are the ones I know I was going to come to you and say, what can I do?
Well,
tough it up, right?
Suck it up. You're pregnant. No, I'm just kidding. I'm just kidding. A lot of women would do have leg cramps, and I know you're very active. So active women will tend to have more aches and pains because your muscles are fatigued. The more water you drink and the better circulation. You know, lack of blood flow in your legs causes anybody to get leg cramps, but especially pregnant women, because most of your blood is right here growing that baby for you and circulating. So increase your water intake and maybe rest a little bit. You know,
sound like my husband.
Put your feet up occasionally. He's right. She should be drinking water and keeping her feet up occasionally.
Taking notes.
So yeah, that's right. And making sure you're eating a well-balanced meal. You know, there are times when your body's deficient in different minerals that can cause the leg cramps. And, you know, we're talking lightheartedly, but there can be some serious complications. If you're having leg pains, it's redness or warmth, that could be a blood clot. That would be something to see your doctor about, which is why it's so important for women to get prenatal care, so that the last few months especially, you're looking at preeclampsia. Every pregnant woman that gets swollen has that fear, and preeclampsia, I'm swelling, that's what it is. You're in Arkansas. You're going to swell.
Yeah.
You're going to be miserable.
Summer.
So keep your prenatal appointments, take your prenatal vitamins, eat a well-balanced meal, increase your fluids, and help circulation. And one thing you can do to kind of help circulation, when you're sitting or walking, that baby is compressing everything from here down, so it decreases circulation. Decrease circulation, you get leg and feet cramps. I have a belly binder, which also can prove as a sash that women can use, and you just put it around the lower part of your belly, or it may not fit around mine, and I'm not pregnant. So, but it's just to kind of help hold the belly up off the pelvis area, so that while you're walking around doing stuff, it doesn't restrict the blood flow as much. And you want to be careful not to get like a girdle. Something like that might compress the baby or your organs too much and cause you further pain. The back pain, also, your body's releasing hormones that causes your joints to kind of get more flexible.
Which is needed.
Which is needed for delivery to make things a little easier. But as you walk and as the baby grows, there's more weight and it's really pulling on your back. And so this also can help a little bit, keep it from pulling quite as much. But pretty much you're going to have back pain. And then if you're hurting, you'll tense one side up more than the other to compensate for what you're feeling, and then you have some back spasms. So you can do a heating pad off and on.
Yes.
Don't ever sleep on a heating pad.
Okay.
You know, too much heat is bad for the baby if you get too hot. But that can help alleviate it off and on. Moist heat is also good.
Okay.
A warm bath, something like that. And then your friend while you're pregnant, Tylenol.
Tylenol, so that's okay to take.
Tylenol is
Okay.
regular Tylenol. Don't get any of them fancy ones, but
Right,
regular
regular
Tylenol is
Tylenol.
great to take.
That's good to know.
And you know, again, fluids. Your muscles thrive on water. If they've got water, then they're going to be more relaxed and less likely to get stressed.
Okay.
So regular exercise and fluids, and your loving
Good
belly
advice.
binder.
I'm taking this with
yeah,
me.
you can. That's yours. That's
Now
from
this
Lori. She
is-
said you could have that.
Some cocoa butter as well for
Yes.
stretch marks, is that right?
Yes, and you know, everybody that gets pregnant, every woman, their fears, oh, I'm going to get stretch marks, I won't be
Yeah.
wearing my bikini. Well, you won't wear your bikini because your hips won't fit in it again. But this whole
Great.
stretch
That was
mark
an uncomfortable
thing,
laugh.
that was,
Oh, nervous laugh.
oh no. But stretch marks is, you know, purely based on your heredity. There's all these things that say, you know, if you use this cream or that cream. I do think lotions, if they make you feel good, put them on. They're not going to hurt you. As long as you don't have anything weird in them, of course. And I brought a few things. I got from the lower end of the scale, real cheap at Walmart, cocoa butter with vitamin E. Your skin loves vitamin E. And so that's kind of lower end scale. Tummy butter doesn't have much of an odor. When you're pregnant, sometimes the odor's bothering
Sure.
you. So that's a good one to use. And then this, I just got at a hair salon. It just feels good.
There's
I don't know that it
really
does a
no-
thing for stretch marks, no,
Right.
but it does make
There's
you
no
feel
miracle
better.
cure or
And
anything
it's
like that.
psychological. It's like, I am not going to get stretch marks, you know.
Do everything I can to be sure. I
And
don't.
right.
pamper yourself right now because
That's
it's all
right.
going out the window.
That's
in-
right.
in
That's
about
what I
2
hear.
months.
You know
That's
very
right.
well.
I do know. I've heard of those things. Yes.
Well, as always, I'll put some of this on the blog that we have
Wonderful.
at
Good.
katv.com as
Yeah.
well, and people can kind of take some
Yeah,
of your
awesome.
advice. and-
Buffy has important work to do.
I know we gotta let you go.
We gotta
I
let
gotta
you
go.
get
Much
back
more
to the
important than
hospital.
this. Okay.
North Little Rock
Thank you
Baptist
very
Health.
much.
Thank you for having me.
And you need to put your feet up at least until tonight's,
Okay, cool. Sounds good.
tonight's newscast. We appreciate you both coming in. Thanks a lot.